Hello everyone. Today we are going to see about cardiotocography. What is a cardiotocography? It is nothing but non-stress test done during labor. Before learning about cardiotocography, one must know about NST and basic concepts of fetal heart rate in detail. In the previous video, we have dealt with NST in detail. We'll see some of the basic concepts of fetal heart rate in this video. What is the normal fetal heart rate? It is 110 to 160 beats per minute. So, a bradycardia in a fetus is fetal heart rate less than 110 beats per minute, and tachycardia in a fetus is fetal heart rate more than 160 beats per minute. What is beat-to-beat variability of fetal heart rate? Fetal heart rate never remains fixed and there will always be some variability. This variability seen in fetal heart rate is called beat-to-beat variability and it is about 5 to 25 beats per minute. If this beat-to-beat variability is absent in fetal heart rate, then it is a bad sign. Absent beat-to-beat variability is seen in compromised fetus, fetal acidosis, and maternal intake of tranquilizers, phenothiazines, and analgesia. What is a sinusoidal heart rate pattern or sine wave pattern? Here, the fetal heart rate remains fixed or stable. There is no beat-to-beat variability seen. Look at the picture 1 and 2. The sinusoidal heart rate pattern or the sine wave pattern either appears fixed or stable as shown in the picture 1 or shows a fixed wave-like pattern as seen in the picture 2. This condition is obvious and this is seen in conditions with fetal anemia like twin-to-twin syndrome in the donor twin, vasa previa or H incompatibility. What is the management of sinusoidal heart rate pattern? It is nothing but immediate termination of pregnancy. In the graph shown on the right, it shows a wave-like pattern of sinusoidal heart rate. What is a fetal heart rate acceleration? Whenever there is fetal movement, there is increase in fetal heart rate, and this is called fetal heart rate acceleration. Fetal heart rate acceleration denotes the fetus is healthy. This increase will usually be 15 beats per minute lasting for 15 seconds in case of fetus of mother with gestational age more than or equal to 32 weeks and 10 beats per minute lasting for 10 seconds in case of fetus of mother with gestational age less than 32 weeks. If fetal heart rate acceleration happens for more than or equal to 2 minutes, then it is called prolonged acceleration. Now we'll see about the fetal deceleration. When uterus contracts, the pressure inside the uterus increases. We all know that the pressure is inversely proportional to volume. So, the blood flow to the fetus decreases. When the blood flow to the fetus decreases, if it is a normal fetus, then the fetus can tolerate this decrease in volume and fetal heart rate still remains normal. If it is a compromised fetus, then fetal heart rate decreases, that is 15 beats per minute for 15 seconds, and this is called as fetal heart rate deceleration. Now we'll see about the types of fetal heart rate deceleration. There are three types of fetal heart rate deceleration. They are early deceleration, late deceleration, and variable deceleration. Early deceleration. Look at the picture shown below. Here, the first wave denotes the fetal heart rate and the second wave denotes the uterine contraction. Here, there is a decrease in fetal heart rate with increase in uterine contraction. So, the dip in fetal heart rate, it coincides with uterine contraction. That is, the dip in fetal heart rate begins when the dip in uterine contraction begins and it ends when it ends. This dip is gradual in onset and lasts for more than or equal to 30 seconds. This is seen in case of head compression and it is a physiological and nothing to worry. Late deceleration. Look at the image shown below. Here the dip in fetal heart rate does not coincide with uterine contraction. That is, the dip in fetal heart rate begins later or after peak of uterine contraction and end after the contraction is over. Here there is a gradual dip and it lasts for more than or equal to 30 seconds. This is seen in case of uteroplacental insufficiency and this is most obvious or worse to happen. Variable deceleration. Look at the image shown below. Dip in fetal heart rate have a variable relationship with uterine contraction, and unlike the early and late deceleration, there is no gradual dip, and here you see a sudden dip in fetal heart rate that is less than 30 seconds. This is seen in case of cord compression. If variable deceleration taking more than or equal to 60 seconds to recover or recurrent for 30 minutes or dip in fetal heart rate during deceleration is more than or equal to 60 beats per minute, then the variable deceleration becomes omnious. Otherwise, it's nothing to worry. These are some of the basic concepts of fetal heart rate, and now we'll enter into the topic cardiotocography. Cardiotocography is categorized into 3 categories, that is class 1, class 2 and class 3. Class 1 is considered to be normal, whereas the class 3 is considered to be worst. We categorize a CTG into a class 1 or normal CTG when it shows normal fetal heart rate, or reactive CTG. Early deceleration may or may not be present, late or variable deceleration absent. We consider a CTG to be class 3 or worse when it shows sinusoidal heart rate pattern, bradycardia, late deceleration, or persistent variable deceleration. So what's the management of category 3 CTG? It's nothing but immediate cesarean section without any delay. Like, share and subscribe the channel. Comment below the topics you want me to deal with. Thank you for watching.